fat cells. Adipocytes, also known as lipocytes and fat cells, are the cells that primarily compose adipose tissue, specialized in storing energy as fat. Adipocytes are derived from mesenchymal stem cells, which give rise to adipocytes, osteoblasts, myocytes, and other cell types. There are two types of adipose tissue: white adipose tissue, WAD, and brown adipose tissue, which are also known as white fat and brown fat respectively, and comprise two types of fat cells. Most recently, the presence of beige adipocytes with a gene expression pattern distinct from either white or brown adipocytes has been described. Mammary gland. A mammary gland is an exocrine gland in mammals that produces milk to feed young offspring. Mammals get their name from the Latin word mamma, breast. The mammary glands are arranged in organs such as the breasts in primates, for example, humans and chimpanzees, the udder in ruminants, for example, cows, goats, and deer, and the dugs of other animals, for example, dogs and cats. Lacturia, the occasional production of milk by the glands, can occur in any mammal, but in most mammals, lactation, the production of enough milk for nursing, occurs only in phenotypic females who have gestated in recent months or years. It is directed by hormonal guidance from sex steroids. In a few mammalian species, male lactation can occur. Intercostal muscle. Intercostal muscles are several groups of muscles that run between the ribs and help form and move the chest wall. The intercostal muscles are mainly involved in the mechanical aspect of breathing. These muscles help expand and shrink the size of the chest cavity to facilitate breathing. There are three principal layers. External intercostal muscles aid in quiet and forced inhalation. They originate on ribs 1 to 11 and have their insertion on ribs 2 to 12. The external intercostals are responsible for the elevation of the ribs and bending them more open, thus expanding the transverse dimensions of the thoracic cavity. Internal intercostal muscles aid in forced expiration. Quiet expiration is a passive process. They originate on ribs 1 to 11 and have their insertions on ribs 2 to 12. Their fibers pass inferior and posterior to insert on the upper margin of the rib and costal cartilage below source. The internal intercostals are responsible for the depression of the ribs and bending them inward, thus decreasing the transverse dimensions of the thoracic cavity. Innermost intercostal muscle. The deep layers of the internal intercostal muscles, which are separated from them by a neurovascular bundle. This in turn is composed of transversus thoracis muscle, sternocostal muscle, subcostalis muscle. Pectoralis. Pectoral muscles, colloquially referred to as pecs, are the muscles that connect the front of the human chest with the bones of the upper arm and shoulder. Deep muscles of the chest, including pectoralis minor, serratus anterior, and subclavius gray 1918. Pectoralis major is a thick, fan-shaped muscle, which makes up the bulk of the chest muscle. It lies under the breast. It serves to flex, extend, and rotate the humerus, the long bone of the upper arm. Pectoralis minor is a thin, triangular muscle located beneath the pectoralis major. It attaches to the ribs and serves to stabilize the scapula, the large bone of the shoulder. The pectoral fascia is a thin layer of tissue over the pectoralis major, extending toward the latissimus dorsi muscle on the back. Along with the pectoralis major and pectoralis minor, the subclavius muscle forms the axilla or armpit. The subclavius moves the shoulder downward and forward. Serratus anterior is another muscle on the front of the chest. It moves the scapula forward around the torso as when throwing a punch. Between the ribs are various groups of intercostal muscles, which help with breathing. Ribs. In vertebrate anatomy, ribs are the long curved bones which form the rib cage. In most tetrapods, ribs surround the chest, enabling the lungs to expand and thus facilitate breathing by expanding the chest cavity. They serve to protect the lungs, heart, and other internal organs of the thorax. In some animals, especially snakes, ribs may provide support and protection for the entire body. Humans have 24 ribs, 12 pairs. The first 7 sets of ribs, known as true ribs, costi viri, also known as vertebrosternal ribs, are directly attached to the sternum through the costal cartilage. Rib 1 is unique and harder to distinguish than other ribs. It is a short, flat C-shaped bone. The vertebral attachment can be found just below the neck, and the majority of this bone can be found above the level of the clavicle. Ribs 2 through 7 have a more traditional appearance and become longer and less curved as they progress downwards. The following 5 sets are known as false ribs costispirae, 3 of these sharing a common cartilaginous connection to the sternum, while the last two 11th and 12th ribs are termed floating ribs, costifluctans, or vertebral ribs. They are attached to the vertebrae only, and not to the sternum, or cartilage coming off of the sternum. Some people lack one of the 2 pairs of floating ribs, while others have a third pair. Fat cells.